We took some time, and finally we are here. So, as you all know, that AspiringShe is conducting this awareness camp for maternal health and child health, and I think they've taken a great initiative in this work. So, I have been invited by them to talk on this platform, and today I'll be talking about the role of homeopathy in maternal health and childcare health. Before starting this topic, I would want to introduce myself. I'm Dr. Yatri Thacker. I'm a homeopath, a mental health expert, and the founder director of Baby and Me programs. Baby and Me programs, we specially curated this for the parents to enhance their parenting journey. As I strongly believe that there is a bond between a mother and the child, or a parent and a child, and this bond begins right from the womb, or right from the time the mother incepts the baby in their womb. So Baby and Me programs are made and where we take care of all your parenting needs, right from infertility, baby care, pregnancy care, post-delivery care, infant care till the teens. We bring it all together, and we enhance even more with homeopathy and counseling. So, as I was saying, that I strongly believe in this bond of a mother and the child, and there have been various cases in my practice which proves this. I remember this case where the mother came with the complaint of an infant who was vomiting continuously, who was 6 months old, and something called as regurgitation was his problem. And we tried to figure out, they gave a lot of homeopathy, allopathy drops, and other things, and they didn't know what was happening to the child. After case taking, there is something which really struck me, and that was the mother's history during pregnancy. During pregnancy, this mother who had a past history of miscarriages, when she conceived this baby, she was so anxious that she kept on thinking, hope my baby grows normal, hope my baby is delivered on time, hope I don't have miscarriage for this baby. And with those continuous anxious thoughts in her mind, she maybe unknowingly just carried forward those thoughts from her womb into the baby. So the baby, when the baby was born, was healthy enough, but later came with this complaint of regurgitation or vomiting on drinking milk as soon as they drink milk. Now, in a way, vomiting is also a way of throwing out the anxiety which the mother had during her pregnancy. So here I am to give you the tips so that you can have a better maternal time or the pregnancy time, the post-delivery time, and of course, some tips on childcare. So there are a few things that one needs to be very careful if they are pregnant. The first and the foremost, they must completely avoid any kind of habits that they have, like if they are consuming alcohol or smoking. This gives rise to miscarriage, and also, if not miscarriage, the stunted growth of the baby. So it is usually seen that the mothers who are alcoholic or are even passive smoker, their children are born before time, or and the children could be having stunted growth. So avoid any kind of bad habits. The other thing that you need to be careful during pregnancy is have a balanced diet. It's so important to have carbohydrates, proteins, fibers, good fat, and vitamins in your diet. Along with that, at least 3 liters of water so that the toxins are thrown out from your body. So have a balanced diet and be a smart eater. So even if you have to go out to eat at your friend's house or you're going out for a party, see to it that you first fill your stomach with healthier options like soup and salads or fruits at home, and then maybe you can imbibe on eating outside. So have a good meal. The third tip for the pregnant moms would be stress-free. Be happy and enjoy every moment, because trust me, nowadays most of us want or have one child or maybe maximum two, and this time will not come back. So enjoy and make the most of what you're doing during pregnancy. So live a stress-free life. This could be done by doing meditation and yoga. And in case if your stress levels goes too high, do consult a counselor. We also are taking online consultation presently and help you for the any kind of stress related issues. Um, the fourth thing that a mother needs to be careful during pregnancy is not to overstrain or overdo anything, rather, listen to your body. So, there might be days when the body says, okay, today I just want to get up and do a lot of activity, and still, since I'm feeling quite healthy about myself. And there would be days when you would just feel like lying down. Don't bring the guilt feeling out there and just give rest to your body. The other thing that you need to be careful while you're pregnant is to see any wrong signs in your body. For example, if you're bleeding suddenly before your labor day or before your 9 months, you must consult your gynec. In case if you have any kind of skill complaint or burning while urinating, if you have chest pain, if you have any kind of discomfort, immediately get in touch with your gynec. Other tip that I would want to give the moms who are pregnant would be that join prenatal class. More so during this pandemic time where you can't reach out to your gynec for every small thing. There are a lot of online prenatal classes available. Baby and Me programs, or I also conduct these prenatal online sessions in India or international clients. And why is this important? Because it prepares you for the D-Day. A lot of mothers don't know what is true labor pains or false labor pains. They could have questions like, when will the umbilical cord of the baby fall for the first time? Or is swaddling so important for the baby or not? Or they could have questions like, what is the right diet for me when my hemoglobin is less? These kind of questions the books also don't answer, or and if you check out on the net, there is too much of information. So prenatal classes surely prepares you for the D-Day. And once you're ready and you have enough information for you, things become much easier for you after delivery. So do join a prenatal class, prenatal info class, as well as prenatal yoga class. So that was my another tip, which was coming is doing yoga or exercises during pregnancy is very important. Your body just doesn't need flexibility at that time, but also what happens is since during pregnancy your body parts become very sensitive and they're prone more towards injury and pain and ache, and yoga or exercise is the best thing to do at that time. So join a prenatal yoga class which will take care of your mind and your body. And last and the final tip is don't shy away to take help from anybody, be it your friends, be it your relatives, be it household help, or be it a doctor or a counselor. If you have discomfort, if you feel there's something wrong in your body, if you are not feeling good mentally, shout out for help because that's so important. If you are happy and healthy, so will be your child. So, maternal health is an indicator of our future generation. And this future generation, you feel blessed to be a part of that growing future generation. We know that there is a direct connection between mother and child, and more so between the mother's health and the child's health. So the statistic says that 161 million children are stunted all over the world due to maternal malnutrition. Imagine the change that you can bring in the whole world if we start taking care of the mother who are pregnant, and automatically you'll be taking care of the future generation which is on its way. You'll be surprised to know that 45% of death 45% of child's death are caused because of maternal malnutrition. It's such a huge number, and let's together come in and bring this change. So I was so happy when Mrs. Tiwari from AspiringShe got in contact with me, and she said, "Doc, we are doing this. Would you want to be a part of it?" And I was more than happy to do it. So let's together bring this change between the maternal care and the infant care. Now, how do you find this connection? And the connection goes actually the state of an adolescent girl who, if doesn't take care of her health, she turns out to be a mother someday. And that mother, while she's pregnant, if her health is good or whatever she feels mentally and physically during her pregnancy is passed on to the infant. That infant someday is going to grow into a child, into an adult, and the circle will go on and on. So we need to break this circle which is causing hamperness to one to another. And this can only be done if you take care of your maternal health and the childcare health. I just mentioned about a few tips and tools that and things that you need to take care to have a beautiful pregnancy and a smooth pregnancy. But along with that, in case if you have any physical complaints, there are certain very good remedies in homeopathy which can treat certain problems that a mother faces during pregnancy. The most importantly is, most of them suffer from morning sickness or acidity. And all they do is pop in a lot of antacids. Instead, homeopathy is a great option. It really helps you to take care of your morning sickness as well as acidity. The other thing during pregnancy that homeopathy can really take care is it helps in easy labor. So when you're in labor, to make your labor easier and progressive, there are certain good homeopathic remedies which you can contact your homeopath, get in touch with them and take. If you are one of those mothers who have had many miscarriages in past, especially in the third month and the fifth month, then again, homeopathy helps. Homeopathy helps in other places, like in case if you have skin issues during pregnancy, like urticaria, skin allergies. I've seen a lot of prenatal moms who come to me with those red patches or dry itching all over the body. Again, we can help you. Then during pregnancy, your tooth becomes very sensitive and it could cause either bleeding of the gums or pain. That's where homeopathy can play a role. Hair fall or even stress during pregnancy, through counseling sessions and homeopathy, we can help you. There's one major place where homeopathy really works, and I specialize in that. That is postpartum depression. This is one area which has just been unnoticed by a lot, and why unnoticed? Because we think, oh, it's okay for a mother post delivery to sit and cry or be happy. But if the mother who's just delivered, if her mood swings last for more than 15 days post delivery, then you must contact a counselor and a homeopath. So I treat these cases with a trio of counseling, homeopathy, and app diagnosis, and it does wonders. Because if you are not happy as a mother, if you can't take care of yourself, how will you ever take care of your family and that little infant or the baby who is in front of you? So remember that be vigilant and be more observant once you become a parent. So these are the places where homeopathy works for pregnant moms. And once you understand this connection, I would want to emphasize that how well, if a mother is mentally and physically strong and happy, so much so is the baby who is happy and mentally and physically fit. Homeopathy plays a role even in childcare. And if the infant or the child has issues like regurgitation, that means vomiting or cuddling, a lot of parents say that, has appetite issues, if the baby is not gaining weight, if the mother has breast milk issues or lactation issues, we can help with homeopathy. The other places is when the child has teething issues, which is very well known, for deworming, for bedwetting, if the child has anger tantrums issues or behavioral issues, it works wonders. There are certain places which all use homeopathy, that is especially for injury, and there are one of them is arnica, which you can use if your child has any kind of injury. You can happily use it. And for local application, calendula works very well if there are cuts and bruises for your child. So this is the role of homeopathy. um, I would want to mention that um, I have come across a lot of patients where they have a lot of myths and questions about homeopathy. And I would want to answer. Of course, in case if any of you um, have any queries related to maternal health or child health, can get in touch with me. So the common questions that patients usually ask me and have myths is they say homeopathy is slow acting. My answer to that is homeopathy is not slow acting. It actually depends on how long the patient is suffering from. For example, if a patient comes to me with a complaint of arthritis, which they have been suffering for 10 years, homeopathy would take at least 6 months or 8 months to, to help the patient, because the patient has been suffering from 10 days, 10 years. But if a patient comes to me with a complaint of fever or diarrhea, which they have been suffering for just 4 to 5 days, homeopathy works within 24 to 48 hours. The results are so fast. So it's a total myth that it is low acting. The other question that patients come up with is homeopathy treats only chronic cases. Again, it's a total myth. Homeopathy can treat acute as well as chronic cases. In fact, acute cases like vomiting, diarrhea, fever can be treated very well with homeopathy, and that also fast in no time. Of course, it works well for chronic diseases, which is well known. And chronic diseases are the diseases which the patient is suffering from a longer time. So in children, there are certain chronic diseases which homeopathy works well. One is all kind of allergies, like skin allergies, like urticaria. Um, then eye allergy, like redness or itching of the eye, and most importantly, the bronchial asthma or the allergic rhinitis. Allergic rhinitis is an upper respiratory tract infection where you usually see these patients, they wake up sneezing at least 30, 40 times a day. The nose is watering continuously, or they have continuous nose blocks. And here we play a major role to help them. That is allergic rhinitis or upper respiratory tract infection. But when this becomes a lower respiratory tract infection like allergic bronchitis, that's where the child starts feeling breathless and is asthmatic, can't breathe, that's and has dry cough or irritating cough. So that's again where we can treat very well. Um, Other chronic cases is skin complaints like eczema, dermatitis, vitiligo, um, other chronic diseases which I see in patients is the behavioral issues, which is very, very common nowadays. Behavioral issues like anger tantrums, children with ADHD, attention deficit, then children having low self-esteem, low confidence, and shyness. I'm seeing in teens a lot of depression nowadays, or exam anxiety related issues. Again, holistically, this can be worked. Other question that patients come up with me for homeopathy or have a question is, Doc, does your medicine have steroids? Do homeopathy have steroids? And my answer to that is no. And there is a way to check whether your homeopath is giving steroids to you. Because when a patient takes steroids, the effect is very quick. Yes, but along with that, there is also puffiness or there is water retention in the body. So if you think that you are taking certain medicines and it is fast acting, it has treated you very fast, and with that you have other issues like water retention, or you've gained weight, or there is puffiness, then you would know that they have steroids. But homeopathy doesn't have steroids. It depends on the age and the time the patient is having these issues, for how long they are suffering, so be its action. So these were my suggestions for you, how it works and what we can do. If you have any queries for this, I'll be more than happy to help you out. You can reach out to me anytime. I'm available. You can on my Facebook page called Dr. Yatri Thacker, and you can just write a message and we can get back to you. Presently, I'm taking online consultations and then couriering the medicines all over India. So that way you can get in touch. Um, and apart from this, I believe that parenting is all about enhancing the child's development holistically. And that is what one must focus at. Uh, so, if you take a holistic treatment for homeopathy, especially where we do not treat the part of the patient, but we treat the patient as a whole. What does that mean? Is say if a child comes to me with asthma issue, and if there are two children having the same issue, yet both the children differ, and so do my medicine. So I just do not treat the asthma per se of both the children. I would treat children overall. So you would see an overall growth in the child. You would see that immunity is boosted in the child, and the changes not only mentally but also physically you would see. That is how homeopathy works holistically. So presently in this pandemic, I have curated a homeopathic immunity kit, which again works as an immunity booster. It is working as a preventive and increasing the energy levels in patients. I have anyways cleared more than 200 immunity kits all over Mumbai. So patients who are keen can again get in touch with me for immunity kit as well, or even for any kind of maternity consultation or child consultation. With this, I would want to end my live session, saying that children are actually like that seed that you want to sow in the soil. For the first few months, you actually take a lot of care of that seed till it blooms into a plant. So, first few years of your child's life is where you need to really take a lot of care of that seed, since it can bloom into a plant. But if you want that plant to become into a tree who would bear fruits and flowers, then you need to take two steps behind and observe that child grow. So give your best to your child who is ready to bloom. For that, parenting is most essential. And parenting, something called as conscious parenting or positive parenting, which I teach a lot of parents. If you can learn those techniques, you will be like that, exactly like that parent who will take two steps behind and see that tree bloom. Here's wishing you all the best and happy parenting. Again, thank you, Samita Tiwari, for having me over. And next week is the breastfeeding week, and we will try and connect again. So, thank you for now.